So in my own research, I tend to, study populations, vulnerable populations. I look at health disparities. Right now I do substantial work in Africa and also do some work in Southeast Asia. And it tends to be that the groups that I work with, many of them are NGOs or non-government organizations. They're not necessarily affiliated with academic institutions. And so they don't have access to libraries in the same way we think. I mean, obviously coming from the US and working for GSU, we're very privileged in terms of what we have access to. But I found that that's really not the case for most of the people that I work with, at least for my international piece. And so when I realized the limited access that they had to resources that I had access to very easily, and also how limited research was done in many of these settings on the topics that I'm interested in, which tends to be research on alcohol and violence and suicide, which are really understudied in these areas in particular. I really felt that it was important for me to give back and make sure that the people who are trying to do work on these topics really have access to the information. So I've been trying to be very mindful when I publish that I make much of it available through open access journals, but I also realize there might be some implications for that. So I also try to think strategically about, where I place, which papers and how I pursue those, options for disseminating the work.